Welcome back to my YouTube channel. In today's video, I'll be talking about rectal bleeding, which simply means passing of blood from the anus. This can be from any part of the gastrointestinal tract, the stomach, the colon, the small intestine, the anus, and the rectum. There are different reasons and causes of rectal bleeding. Hemorrhoids, which is bulging of the veins around the anal canal, and when this occurs, the blood supply to that region increases. If the resident is constipated during defecation, there will be pressure applied to that region, and which will result in bleeding. Anal fissure is also another reason for rectal bleeding. This is a tear to the skin of the anal canal, and during defecation, it can result in painful bleeding. Another reason is inflammatory bowel disease, such as Crohn's disease or ulcerative colitis. It can also occur due to peptic ulcer, and it can also occur due to colorectal cancer. It is very important to inform the GP about any form of rectal bleeding, because residents who are at the age of above 50, there's more risk of colorectal cancer. The color of the blood is very significant to determine where the bleeding is occurring from, the source of the bleeding. If the blood is bright, fresh blood, it simply means that it's occurring from the lower colon, the anus, or the rectum. If the blood is dark, it indicates that the bleeding is occurring from the upper part of the colon. If the stool is black or tarry, this is as a result of the bleeding taking place from the upper parts of the gastrointestinal tract, such as the stomach. And also, the stool can become very black because probably the blood has been digested before it's been passed out. And also, the blood becomes altered as it travels through different parts of the body. When a resident presents with anal bleeding, it's important to assess the resident yourself. Check the vital signs. Have a look out for if the blood pressure is very low, if their heart rate is high, as they could be at risk of shock. And also, you have to monitor if there's any fever, because fever is an indication of an infection. Look out for other signs such as abdominal pain, change in their bowel movements, and look out for things like diarrhea. Look out for the residents having unexplained weight loss, which is very common with colorectal cancer. Cancerous cells tend to use more energy compared to normal cells, so you'll find the residents losing weight despite having a normal diet. Also, observe if the resident is on any iron tablets, as this can result to their stool becoming black. Check if the resident is on any anticoagulant such as endosulfan, clopidogrel, apixaban, aspirin. This medication increases the risk of bleeding, and that could be the reason why they are bleeding. Residents with anal bleeding needs to be referred to the GP, because it could be something as minimal as hemorrhoids and anal ulcers, but it can also be as something as serious as colorectal cancer. So following your assessment, it's important to update the GP about your findings. Let the GP know the vital signs, the associated symptoms, if they are presenting with fever, abdominal pain, diarrhea. Let the GP know all these informations. This is because the GP will need those informations to determine if to refer them for colonoscopy or endoscopy to see what is happening within their gastrointestinal tract. This decision will be made in consultation with the next of kin, while thinking and analyzing the benefits and the risk involved in further investigation on management and how it will affect their quality of life. Please note that ferrous medications can also result in black tarry stools. And thank you for viewing. If this video has been informative, kindly like, share, and subscribe to my YouTube channel. Thank you.